Welcome. My name is Dr. Maida Galvez. I'm a pediatrician here at Mount Sinai. I too trained in the Bronx at Montefiore and Jacobi, and it was seeing the problems that were so rooted in neighborhood that drew me to a fellowship here at Mount Sinai in environmental pediatrics under the mentorship of Dr. Philip Landergan and the wonderful team that's here in environmental medicine. And what we saw was that, to really understand a children's risk for adverse health outcomes from like asthma, you really had to put that child in the context of their community. And by community, we mean where they live, learn, eat, sleep, and play. And so I'm going to walk you through a little bit of what we see from the clinical perspective. This is an infographic from the American Academy of Pediatrics showing the rates of childhood poverty across the United States. And so what you see is that for all of New York State, the child poverty rate is about 20%. But when you hone in on certain communities, like East Harlem, 42% of East Harlem children are living in poverty, 60% in the South Bronx, 50% in places like Puerto Rico. These numbers are staggering. And how does that impact children's health? Those families living in poverty are also more likely to be living in substandard housing. And this is a report on housing and how New York lives from 2014. And nearly a third of public housing tenants reported water leaks. And East Harlem, of any neighborhood in New York City, in Manhattan, ranked number one in average housing concerns. And these disparities exist in housing in terms of racial ethnic disparities. So 34% of black households reported 3 or more serious maintenance deficiencies in rent-regulated apartments, compared to 16% of the white households. There's a terrific resource from the New York City Department of Health called the Environmental Health Data Portal, and it's something that very clearly outlines these disparities in terms of environmental exposures. And so you could look neighborhood by neighborhood at how environmental risk factors differ. And so you see on this portal an asthma infographic. And here is the disparities by 2 neighborhoods in New York City, comparing cracks, leaks, and roaches, which increase a child's risk for asthma hospitalizations in a low asthma hospitalization neighborhood like Borough Park, compared to a high asthma hospitalization neighborhood like Hunts Point, where the poverty levels approximate 59%. And if you drill deeper, you can get to reports like this on home maintenance and housing conditions that can affect asthma. And so what they have are data on East Harlem compared to Manhattan and New York City overall, how it compares to other New York City neighborhoods and trends over time. And what you see is that for homes with cracks or holes, homes with leaks, and homes with 3 or more maintenance deficiencies, East Harlem has double the prevalence, 33% homes with cracks or holes compared to 15% of New York City homes as a whole. And when it comes to pests and pesticides, homes with cockroaches and homes with personal use of pesticide sprays, bombs, or foggers, again, nearly double compared to New York City overall. And this is what we're seeing from our federally funded Region 2 PEDS Environmental Health Specialty Unit. So this is a home visit that we did a number of years ago here in Central Harlem, actually. And it shows you how a simple water leak can rapidly progress. And there are families living in the neighborhoods very close to here, in buildings and homes like this. And I think that all of us here today are trying to attack this from different perspectives from the agencies that we represent, but we can all agree that this is not a safe and healthy home environment for children and pregnant women. And so our shared vision is that we will get to a point where we as clinicians are prescribing healthy homes for all children and families. And we have a social media team here with us today. We have 2 Twitter handles. One is hashtag Region 2 Healthy Home Summit, and the other is hashtag Prescription Healthy Homes. And we want all of you to share with your followers the key messages that you're taking home from the summit today, so we can spread the word and really solidify this movement. We have a number of committees that have been working very hard in pre-conference planning to achieve this shared vision. Those committees include Puerto Rico and the U.S. Virgin Islands, tribal nations in Region 2, New Jersey, New York City, and New York State. And if you've served on those planning committees, can you please sort of wave your hand? Terrific, wonderful. By the big round of applause for those committees. By the end of this day, we would love to have every hand raised as someone who's joining a committee to work with us on post-conference planning and working towards implementation of some of the things that we learned today. And as an environmental pediatrician, I'm really here to learn from all of you. I have much to learn in this area, so I am really thrilled to be here as a learner. And we want to welcome you all from near and far, and folks have traveled from very far. And if not from very far, sometimes through a lot of traffic to be here today. So we are so appreciative, and I wanted to welcome all of you. Amisha mentioned that this is the second summit held here. This is my first. I came here 13 years ago now. And I am so excited to see people from across the region coming together to talk about this issue. And we've said to others that we consider this our regional wedding. And that all of you are family, and that we have much to learn from each other. And so I want the people that I encountered in my training at Jacobi Medical Center in the Bronx, Maida Galvez, to meet the boss of my college best friend, Dr. Mohammed. And I want all of you to network and meet each other and learn from each other and see how together we can achieve this shared vision of prescribing healthy homes. And so what we're really trying to do today is connect the dots, is to think about how the city, state, federal agencies, the community-based organizations, the health systems can more effectively work together, share information, and get families the interventions that they need to prevent and reduce environmental exposures. I just want to thank all of you who have been part of making this conference a success, and look forward to learning from all of you. Thank you so much.